Hello friends, I am Dr. Mukulesh Gupta from Udyan Healthcare Private Limited, Lucknow. And as you know that we are approaching the fag end of 2024, so I thought that let us pick some top stories in 2024 in the field of cardiology. So first, I'll be talking about the ESPRIT trial. As you know that the ESPRIT trial long back, it mentions that if suppose we are targeting the BP control to less than 120 against less than 140, it is giving us a favorable response. But then during this particular trial, it was pointed that it was office BP that was measured and that was responsible for those differences. But the same thing is now approved with ESPRIT trial, which is a Chinese trial with 11,255 individuals and average age of 65 years. And this particular trial tried to compare the MACE outcomes and the hospitalization for heart failure and the stroke outcomes with patients, those who are targeted at blood pressure less than 120 and BP less than 140. And what did it reveal? It revealed that there was a significant p-value, that is 9.7% versus 11.1%. That means that that same story, that should we be targeting blood pressure less than 120 millimeter mercury, is something which is preferable. And this debate is once again heated up that probably we should be targeting a blood pressure less than 120, but we should be taking care of patients, those who are frail and those who are older subjects. So that was about the first study. Then the second study, which answers a very unique question, because this is something which is asked by many of our elderly colleagues and patients, those who are suffering from osteoarthritis or other disorders of bone and joint, that we are not able to do aerobic exercises. And the lifestyle management, it mandates that we should be doing exercises to the tune of at least 30 minutes per day, 5 times in a week minimum. How will we be able to do it? So that is the question which is now answered, that even the resistance functional exercises, they are good enough and prove to be an alternative to patients, those who are not able to do aerobic exercises. So probably sitting in your chair or maybe doing some functional exercises, some weight trainings, or maybe some the limb exercises, that is good enough and it is an alternative to aerobic exercises if suppose we are not able to do that. The third pick is very important because this is something which is an eye-opener, and that is the microplastics. Now this is coming from a very reputed journal, as we all know, that is NEJM. And Marfella and colleagues, they studied the specimen coming from 247 subjects where the carotid and arterectomy was done. And it was found that microplastics, they were found in 157 patients out of these 247. So, and then patients, those who suffered MACE and those who didn't suffer MACE, there was a significant correlation and significant p-value in patients, those who are having microplastics present in their atheromatous plaque. Now, it is very typical that though there are various sorts of microplastics which are finding an excess in human body, but then polyethylene and polyvinyl chloride, these are two specific microplastics. They are found in this atheromatous plaques, while the others, they are not. But this is a source of worry because we know that during hospitalization, we use multiple plastic things, including the IV channels, the bottles, so on and so forth. And in day-to-day life, we use plastics in our life, and they find access in form of microplastics and find their route into the atheromatous plaque. And this is one of the things which may be responsible for more of ASCVD, and that is the atherosclerotic cardiovascular disease. So these are my 3 strong picks as far as the world of hypertension is concerned in last year, that is 2024. Thank you so much for your patient listening.